Good morning, everyone. Good afternoon. This is Jaime Gonzalez at the Health Plan Alliance. Thank you very much for joining us for our Vendor Spotlight webinar today featuring WebMD. Today's presentation is entitled Gamification in Health Leveraging Wellness Challenges to Increase Member Engagement. Our guest speakers today are Christiane Jones, who's the Director of Product Management at WebMD, and Jennifer Yates, one of our member plans, who is the Manager of Health and Wellness at SummaCare. Christiane and Jennifer, welcome, and thank you for joining us today and presenting this case study that we're going to learn more about WebMD and the work that you guys are doing at SummaCare. To all of our members, thank you for joining us. Our Vendor Spotlight webinar program is designed to give you the opportunity to learn about different organizations that are interested in working with you. In today's case study that you're going to hear about, you're actually going to see the work that WebMD is doing with one of our member plans with SummaCare. And our colleague Jennifer there at SummaCare and another colleague of hers, Mary Jo, will be giving you some insights at the work that WebMD is doing with them. Again, feel free at any time to ask questions during this presentation. We'll be using the chat function. The chat is right here you'll see the box there. You can chat publicly with everyone. You can chat with the presenters, or you can chat privately. But we ask that if you have questions at any time, just post your questions in the chat and they'll take care of addressing those questions for you. There's also the handouts up here at the top. You'll see the handouts tab across the top. That's where you'll find today's presentation. So you can click on there. You'll see there's a PDF there. And Ro, it's ready to, let me see here. I'm going to click the share button so that now it's there. And now it's ready to, you can see it. So it's there for your availability. Just you click on the link and you'll be able to download that presentation at any time. The other place you can find the presentation is on the events site under the Documents tab, the same place where you registered for the webinar today. So if you want to download it from there, please feel free to do that as well. Additionally, you can find more information about WebMD in our vendor directory. Just go into the directory, pull up their name, and you'll learn more about there's a profile for them in there, so you can learn more about the organization. As well as our guest speakers today, you will be able to, in the same place where you registered, under the Speakers tab, you'll see a brief profile for each of the speakers along with their contact information. So if you want to reach out to your colleagues at SummaCare, if you want to reach out to Jennifer, if you want to reach out to Christiane at WebMD, feel free to do that as well. Again, take this opportunity to learn about the organization. If there's an interest on your part, I'm sure Christiane would be happy to talk with you in more detail after the webinar. If you want to set up an appointment to visit with her, she'll be reaching out to you as well if you do have further questions. And if you want to talk to Jennifer, one of your peers from SummaCare, about her experience with WebMD, I'm sure Jennifer would welcome the conversation with you as well. Everybody's in muted mode. Again, if you would like to ask a question live, press all you have to do in the chat function is raise your hand and we'll help you to enable your mic so you can ask the question live. If you don't want to ask a live question, just post your question in the chat and we'll take the question from there. At the end of the webinar, there's a brief survey right after you log off, and we'd appreciate you to take the time to complete the survey and give us your feedback on your experience with today's webinar and the information that you learned, as well as the use of this particular program to help you better understand what different organizations are offering. So again, please use the chat function to ask questions. The entire presentation is being recorded. If someone was unable to attend today, one of your colleagues, if you want to go back and listen to it, the recording will be available under the Events tab. Excuse me, in the Events site under the Documents tab. So with that being said, I am going to turn it over to Christiane, the Director of Product Management at WebMD. So Christiane, welcome, and thank you for hosting and sponsoring today's webinar.
Thanks, Jaime. I appreciate it. And hello and welcome to all of you attending today. Our presentation is on gamification in health, leveraging wellness challenges to increase member engagement. As Jaime mentioned, my name is Christiane Jones. I'm the Director of Product Management for WebMD Health Services. I am thrilled to be presenting today alongside Jennifer Yates, who is the Manager of Health and Wellness at SummaCare. We're going to present on how challenges can empower your populations, which, as we all know, is needed now more than ever. Before we get started today, let's take a look at our agenda. We'll begin by taking a look at the state of well-being and how trends are shifting, especially in our current. Then we're going to take a look at a way to think about engagement, really meeting members where they're at in their well-being journey and helping to drive long-term behavior change. Then we'll share how gamification can help maximize the effectiveness of your well-being program, and you'll meet our client, SummaCare. One of their employees is going to share her story about how she saw some life-changing results utilizing their well-being challenges. And then we'll finish with a look ahead to 2021. And just as a reminder, as Jaime mentioned, the session is interactive, so we're standing by to answer your questions. If you have any questions, please feel free to chat them to us anytime during the presentation. So let's start by talking about the state of well-being programs. The Business Group on Health recently released 2 studies that shed light on how employers intend to shape their well-being programs, as well as what employees are looking for in a workplace well-being offering. While these studies were conducted prior to the pandemic, the insights reveal some of the important areas of focus that individuals are starting to think about that have since been highlighted by our public health crisis and will continue to impact employees' physical and emotional wellness into the next year. There were 4 particular areas that were highlighted in these studies as areas of focus. One was financial wellness. As we all know, as people are encountering some of the impacts of the economic fallout of the pandemic, they're looking for additional resources and education on financial wellness and financial planning. Social connectedness is the second area that's been mentioned. Obviously, we are all operating in a state of new normal, and it's causing people to reconsider how they connect with others and how we maintain relationships while physical distancing measures are necessary. Third area that they focused on was mental health. As we can probably all relate to, there's a lot of uncertainty in our world right now, and it's created an uptick in the focus on mental health and then the mental resilience tools that we all need to navigate these new and changing times. And then last, stress, burnout, and sleep were stressed as well. We call them the trifecta. There are 3 factors that have been identified as deeply connected and deeply impactful for total wellness. Okay, if we keep moving. So how can we help your members thrive during this time? At WebMD Health Services, we are helping populations by providing personalized recommendations and information that's relevant to every individual at every stage of life. We do it by delivering on the 5 dimensions of well-being: physical health, emotional health, financial health, social health, and clinical health. We're focused on the multiple dimensions of well-being that deliver a holistic approach to the well-being journey. And we provide our participants with resources to help them move forward in their well-being journey, no matter what their current illness is, based on their current stage of life. I see we have a question here. What resources have we added to our wellness program to support people during COVID-19? It's a great question. At WebMD Health Services, we've added a variety of tools and solutions to help our clients and our participants. Among them, we implemented a free case regarding COVID-19. The Beyond Well mental health podcast, which gives individuals resources to help them and that really to deal with changes where they're at. At WebMD, we know that well-being doesn't happen in a day or with just a few clicks of the mouse. It takes time, commitment, engagement, accountability, efforts, being a 5K finisher. Uh, from being financially stressed to a financial plan, from being stressed out to finding tools, mental resilience. Our programs extend beyond simply counting clicks to what really matters, which is true behavior change. We focus on building daily habits that align to the unique of each individual. And at our foundation is a unique blended behavioral science approach to create lasting habits. We start with small lifestyle changes, and we focus on making those small increments with countable goals to help individuals on that journey towards total well-being. It's all about making those small incremental changes, finding support, and celebrating success along the way. So how do we approach behavior change? In order for us to understand and affect meaningful behavior change for an individual, if you think about it as a cyclical step is learning about your own health, your goals, how to start making long-term habit changes that have long-term ROI or V for our clients. The second step is action, making easy to achieve goals, coming up with a plan, implementing goal visualization, and finding ways to make small environment that behave. The third stage is rewards, and this can be offered through a well-being program, but we also encourage individuals to build small rewards into their plan so that as they make those small incremental changes, they're focusing on celebrating their successes. The last step in this four-step cycle is evaluation. So once you have learned about your well-being goals and the best way to achieve those, and you've taken action, and you've celebrated your successes, it's time to evaluate and think about what that step is long term. We've found that it's particularly helpful in working behavior change is via challenges. In fact, earlier this year, WebMD Health Services conducted a well-being survey. We surveyed 2,000 employees and we set out to explore the state of employee well-being. We asked survey participants questions about stress, being a caregiver, loneliness, how they view their well-being, and what they'd like to see in a well program. A lot of interesting insights on this. Overall, 87% of our surveyed participants said that they were very willing to participate in a wellness challenge, and a steps-based walking challenge was ranked the top challenge of interest, followed closely by hydration. Millennials were 19% more likely to say they were very interested in wellness challenges. The top areas of focus were walking challenges and drinking more water. And both women and millennials are more likely to participate every type of challenge, no matter the area of focus. They also noted in the survey that convenience is a factor. Time is precious for individuals. And so having an app, something that people can use when they have time and when it fits into their own schedule is critical for well-being challenges. There are steps we recommend as you start launching a well-being challenge. The first is what your topic of focus is going to be. For example, you want your population to be thinking about getting more exercise or getting more sleep. Thinking about what it is that you want to tackle from a well-being perspective is the first step in planning. And then about which groups you'll do. Is it going to be employees? Is it going to be a specific location or some other subset of your population? So thinking about targeting with this challenge. The third step is what kind of challenge format will you offer? The invitational we'll hear more about when Jen takes over the presentation. We also have challenges that can be employed to help engage your population. So thinking about what that format will be is important. Fourth, and perhaps most importantly, what does that communication plan look like? You want to get the word out to folks about the challenge in place, communicate how to sign up, and any sort of incentives that are in place and what they need to do to earn those incentives. Fifth, how to define success for this challenge. What is it that you accomplish with your population, and how are you going to measure that? Sixth, what incentives are you planning to offer? Is this something that will earn them a credit towards their premiums? Is it something where you're doing a drawing, perhaps a raffle for a connected device or something of that sort? But thinking about what rewards or incentives you might be willing to offer is also critical in the planning for your challenge. I know SummaCare is going to be sharing some examples of what they did to make their challenges so successful for their. I have another question. How much time do you guess that an organization should anticipate to set up a challenge? I think the answer there is it's never too early as you're thinking about your benefits program. It's great to get those challenges on the calendar and start about how they fit into your overall well-being program and strategy. But definitely recommend, at least a couple of months in advance that you're thinking about how you want to launch your challenge, because communication is key. And you want to make sure that you have enough communication for launch. Okay, now I would like to introduce to you Jennifer Yates. She's a manager of health and wellness with SummaCare, exercise physiology. She is a certified health coach. And in her role, she oversees health includes management, health, clinical campaigns, and provider relations. Suma's been a client of WebMD since 2008, and we are thrilled to have them here with us today to share with you about some of the successes that they've seen with their program. And we hope that it sparks some new ideas for you and for your population. I'll turn over to Jen.
Thank you, Christy-Ann. I am very privileged to be able to speak with everyone today, and I'm excited to share with you how SummaCare uses the WebMD tool. I am the manager of health and wellness and recently just added provider engagement as well. So if you have any questions, please feel free to reach out to me on any of the aspects that I'm about to share with you. So let me first tell you a little bit about SummaCare. SummaCare is a regional health plan located in Akron, Ohio. We were formed in the 90s. We are one of the only region's provider-owned health insurance plan. We offer Medicare Advantage, commercial self-funded and fully insured, as well as individual on and off the marketplace plans. We have about 320 employees and about 150,000 members. We are obviously CMS star rating accredited and NCQA accredited. So our star ratings, we have been holding strong at a 4.5 star for 3 consecutive years. We are extremely proud of that. We are one of 2 health plans in Ohio who currently have a 4.5 star rating for 2020. So we are also very happy to have WebMD as our population health management aspect for our NCQA accreditation, because we also receive auto credit for that aspect of WebMD's health management tool. We are a branch of Summa Health. So Summa Health System is what is pictured here. That is our mother company. They are the hospital system. They have lots of different hospitals, urgent care, behavioral health, women's wards. We have several facilities. So we are a branch of Summa Health, but a lot of my presentation is going to talk about Summa Health as a client. So not only am I a Summa employee, but I treat Summa Health as a client like I would any of my other self-funded groups. Summa Health is one of the largest integrated healthcare delivery systems in Ohio. It was formed in 1989, serves more than 1 million patients a year. And as I was mentioning, we have hospitals, we have our own ACO, we have specialties, we do research and medical education, multiple foundations. We are the largest employer in Summit County with 8,000 employees. So let me talk to you about Summa as our client. So let me give you a little bit of history about how Summa utilized the WebMD tool before they launched the Invitational Rewards or Challenge program that I'm going to tell you about. So about 5 years ago, Summa had different leadership, different employee wellness director, and we had a rewards program launched using the WebMD tool. And the way that it was launched was different than how we do it today. So, and we also changed leadership, changed different directions. And so let's fast forward to today, and I'll show you how Summa uses it today. So about 5 years ago was when we stopped using it. That was the last time that Summa Health as a client used this tool. And we completely came back full force and really hit the ground running. And I'm really excited what they did this year.
Jennifer, excuse
Yeah.
me, I'm sorry, this is Jaime. Jennifer, I'm sorry, this is Jaime. Can you hear me?
Yes.
We're having a hard time hearing you, and I'm wondering if you turn your camera off, that might help. So it gives you more bandwidth, because you're coming across really choppy when you're presenting right now over the audio part. Do you want to try turning your camera off and see if that'll help?
Okay.
Now
Does
go
this
ahead and
sound better?
continue talking. Let's see.
How is this now? Testing 1, 2, 3.
I don't hear you if you're talking.
Oh, everybody's saying they can hear me clearly.
Okay, so it sounds like everyone else can hear, but it must be on our side. Go ahead and continue, Jennifer. I'm sorry.
Anne's presentation was choppy.
Turn your camera off, Jennifer, if you don't mind.
Can you still
Okay.
hear me? Okay. Sorry about that, everyone. I'm sure we have all experienced technical difficulties over this pandemic.
It sounds like our members can hear you okay,
Yeah.
Jennifer. So if you want to continue talking and presenting, please go by
I
all means
can.
do.
Okay. All right, let me resume.
Okay. Sounds better.
Okay, thank you. Thank you for your assistance. As you can see on this slide, this is Summa Health's Employee Wellness Program. This is using the WebMD rewards portion of the platform. This is completely customizable, and every client that we have that utilizes this platform is able to individualize how they build their rewards program. So with Summa, they wanted these categories. They wanted an annual well visit and preventive screening to be the #1 activity to be completed. Then the Health Quest survey. The Health Quest survey drives a lot of participation for our SummaCare programs, such as health coaching and condition management, as well as the end user will get immediate feedback on their health risk score. It compares them to like individuals of similar ages and genders, and they get immediate tips and advice on how to improve their risk factors. So the Health Quest survey, we've kept that as a standalone activity. Then the other categories are diabetes and prediabetes care, blood pressure, stress management, and healthy lifestyles. So we wanted to give employees the opportunities to help them improve or avoid a chronic condition, as well as help draw attention to resources that are available to them. So for their program, the employee must complete the annual well visit or preventive screening in order to be eligible for the other categories. And once they complete these categories, they get put into a drawing to win a prize. Gift cards, tennis shoes, we've given away all kinds of different things. So they get put into a drawing. So to highlight the annual well visit category, we took a lot of the load off of the client, and we utilize our HEDIS measures that we are measuring and reporting on anyways for NCQA accreditation. And we have a report that automatically tells us, based off of claims, who has completed this category, and we are able to drop that onto an Excel file template and upload it to WebMD. So the end user does not have to report back to HR or their wellness director that they've completed this activity. It's taken a lot of burden off of those employees on knowing whether or not their activity was redeemed, whether it was received, and that's also helped reduce the burden on HR and the employee wellness director that they're not answering as many questions. So when we receive a claim for their mammogram, annual well visit, colonoscopy, it automatically gets uploaded into WebMD so the end user can see when they've received credit for that activity. We also have the healthy lifestyle section that is on the right. We promote our programs and our Summa Health, our client programs as well. So Summa has a weight management institute, and we offer employees that have a BMI greater than 30, medical nutrition therapy or nutritional counseling. So we call that out here. We have the Invitational Step Challenge here. And we've called out WebMD's tracking tools, an upcoming sleep challenge. We have SummaCare's benefits, such as a smoking cessation program, our 24-hour nurse line, and even Summa's virtual visit service. So we try to highlight every benefit and every option from both the employer group and from SummaCare, the health plan, and give all of that information right up front to the employee and give them credit for using these tools. For their diabetes and pre-diabetes care section, same thing. We have a condition management program. We have a specialized benefit that offers them free tier 1 medications, no PCP or preventive screening copays when related to diabetes or hypertension. They also get free testing supplies when ordered through our durable medical equipment provider. So this is just some examples of how we're calling out our benefits and resources available to the end users, all in one beautiful location that organizes it well, and it's easy to read and flow through and be able to click that they've did this. We can validate on our end on claims and our participation reports for our programs. And again, everything is customizable. So what Summa Health uses as a client is completely different than another hospital system that uses this as well. So that was the rewards program. That's how they design their employee wellness program and use that tool. Of course, there's lots of participation reports that is sent back to the client, and that's how they enter their employees into a drawing to win the prizes. So one of the facets that Summa did in 2019 was the Invitational. This is a team-based steps challenge that is so fun and interactive. I honestly have never had more fun with a challenge than with the Invitational. So it was Summa's first WebMD challenge. So they've done other challenges internally, like a maintain, don't gain, which is a lot of paperwork. They have to go to every location and weigh people in. They have to weigh them out, and it's a lot of legwork for the staff. So being digitalized and having the gamification, it's so fun. It's so user-friendly. There's an app that you can enter your steps. You can sync your device. It's very user-friendly. So when participants sign up, they can either create a team or join another team. There are 5 participants on each team, and you compete against a new team each week for 5 weeks. So if you don't have a team, it's fine. You just join one. But if you have some coworkers that you want to create a team with, then you can do it that way. And the Invitational uses smart logic to pair your team up to a comparable stepping team. So with a large hospital system, we have security and nursing staff and physicians that are on their feet all day. And then you have office staff that are doing claims analysis. They're more cubicle based. So you don't want to pair a low stepping team to a high stepping team. So the smart logic gets to know how your team averages and will compare you to a like team. So that's not discouraging. I really like that feature about this. I see Jamie has submitted a question. So team challenges can sometimes feel competitive. Have you felt like the competition element was a turnoff to any of your populations? That goes hand in hand with what I was saying about the smart logic. So it's not a deterrent because you're actually compared with a team that has similar step averages to you. So if you are in a cubicle setting and you got compared to a nursing staff that just completely annihilated your steps, that would be very discouraging. But you're not. The smart logic puts you with a like team, and the competition actually drives more steps. I have had a lot of employer groups that have come back and said, I love the competition. It has helped with camaraderie. A little bit of smack talk too. It's all been very cordial and nobody has got out of hand. And we've ran the invitationals quite a few times with different clients, and I've never had a bad experience. So Summa launched this invitational in 2019 before they even had a rewards program built. So the first thing they did was the invitational, and then they came back and built the rewards program. So that goes hand in hand with the engagement that I'm going to show you later, the engagement numbers. So we already had another health system that was running both the rewards programs and challenges. So I think this pushed Summa Health to launch their own. Knowing this was the first WebMD activity to be used in a few years, they achieved great participation. So this was the first time they had asked their employees to come back into the WebMD tool and join an activity. So we had 52 teams. We averaged 82.8 million steps taken with an average of 10,434 steps per day per participant. That was great engagement right off the rip for being the first WebMD activity that they've done in quite a few years. The invitational, when we are building our communication and planning for a challenge, we follow WebMD's 6 steps for building building a challenge. First is the topic. So you have to decide what challenge you want to do. And what are you looking for? So we wanted to time it right after that internal challenge that they did, the maintain, don't gain over the holidays. So once that ended, we wanted to continue the resources and give them some more motivation to keep going. And we also timed it with New Year's resolutions. So we launched it in January, right after the holidays. They had just completed one challenge, and everybody's getting ready to start their New Year's resolutions. Lose weight, increase your activity, and get healthy. It's also, we are in Northeast Ohio, and there's unpredictable weather. So we wanted to give them something that would motivate them while it was winter. And it's very easy to get outside and be active. And it's a great time to run Steps Challenge then too. But we wanted them to be a little bit more motivated during those winter months and use their coworkers to help keep them motivated. So for the group, it's all SUMA benefit eligible employees. For most of our memberships, it's only if you are on the SummaCare insurance health plan that you have access to WebMD tools. But because Summa Health is a larger hospital system and they are our parent company, we allow them to send the non-insured individuals over to us for eligibility. So even if they're not on our health plan for Summa, we will allow their employees to come onto the tool so that they can still use WebMD and engage in the employee wellness program. We then chose our challenge. So WebMD has classic challenges as well, but we really wanted the team base for that competition and that camaraderie. Communications, we use WebMD's communication hours to build a strategy and content. Prior to this, it was unutilized, our communication hours. So I'm sorry, I'm hearing feedback and maybe that's me, so I apologize if you hear the feedback. I'll turn my volume down. So WebMD has a communication specialist and hours in our contract that we are able to utilize them for, and they helped us build flyers and content for all our avenues that we were communicating this challenge for. For metrics, we track all of our results using the reporting tools that are within WebMD Site Manager. There are individual and team participation reports. And the rewards, the client decided to do a drawing for tracking devices. So they had 3 or 4 different tracking devices that they were giving away, as well as gift cards. So if you participated in the challenge and you were engaged in all 5 weeks of the challenge, then you got put into the drawing. We did not specify that you had to reach 10,000 steps a day because everybody has a different journey that they're on and different goals. So we just wanted individuals to participate and complete the challenge. So our communication avenue, this is our CEO. He is Dr. Devaney at the mothership of Summa Health. He has cliff notes that he does every week. They are little short 2-3 minute videos, and they are content is system-wide. It could be about the foundation or a new facility that's getting built or updates about COVID. So he did a shout out for the rewards program and the invitational to help get individuals involved and engaged and aware of the resources. So we are very thankful to have support from our CEO on down. So that really impacts everything that we do to have support from the top down. Our invitational this year, our own chief medical officer even participated in the invitational and joined the team. So having that buy-in from leadership and not only just saying to do it, but to actually join in on the challenge is wonderful support that we have our leadership. We also have Summa Voices. That's like our internal social media platform that we can post pictures and content, and we can link out to other things. So we post there. We have a news you can use bulletin that goes out frequently. So we will post activities there. We have an HR newsletter. We even have blogs from leaderships and, of course, emails and flyers. And we try to basically think through every single touch point to a member and how we can communicate on every single touch point. Here is the flyer and content that the WebMD communication specialists help us build. We email these flyers, we post them to websites. Every time we send any communication, we link back to the flyer because it's the who, what, when, and how. How do you register? Who is eligible? When does it start? And what's the prize as well? So every time we communicate, it links back to this. There's also email signatures that we can use for internal communication when you're talking to a fellow coworker or you're answering questions about the challenge or answering questions about anything. The email signature can be there to promote the upcoming challenge. There are banner ads, so if you have television screens or monitors that are in break rooms, you can also have an ad being played for employees. And as well as on-site promotion. So we call it the traveling roadshow, where we've had tables set up at all of our different facilities and our flyers and a staff member there to help promote the upcoming event, and as well as a laptop to help them register. So how many weeks prior to the challenge did you start promoting it? We had everything in place probably 4 weeks prior to launch, but 1 week prior is when we did a coming soon announcement. So I'm sure all of you have the same issues whenever you launch something using anything that has to do with a login, username, and password. That is the #1 barrier. I don't know my username and password. I'm locked out. Where can I find it? How do I get in? So we start 1 week prior to registration with a coming soon. This is how you register. Make sure you know your username and password. If you're locked out, this is what you do. So we want everybody to get logged in and get prepared. Then 1 week later, we'll do the registration is now open. So to hear a success story, I can tell you engagement numbers and talk about how great the tool is and how we customize it for every client. But what really resonates is a story. Hearing how a program made a difference in someone's life is why we do what we do. Mary Jo is a SummaCare customer service representative who participated in SUMA's 2019 Invitational. Mary Jo is also a celebrity amongst the customer service representatives. She has individuals that call her and request her. We've had an event, an expo, and we had members take selfies with Mary Jo. So not only is she a wonderful employee, but she's also a wonderful coworker. She has also helped me with the American Heart Association Heart Walk Committee as a team captain. I just love working with her, but I want Mary Jo to tell her story as a participant. So Mary Jo, I will let you tell your story. Are you able to log on? Turn your microphone on. Mary Jo?
Okay, can you hear me?
I can
We
hear
can hear you
you.
now.
Can you hear me?
We can hear you now, Mary Jo.
Okay, thank you. Thank you, Jen.
You're welcome.
So September 11th of 2018 was a life-changing day for me, very literally. I was scheduled for the afternoon shift, and I traded with someone so that I got off at 4:30. My husband was supposed to be out of town, and he changed his mind and stayed in town. And I worked my shift. I got off at 4:30. I came home. I was cooking dinner, and I didn't feel right. I couldn't really describe it. I just didn't feel right. So I went into my husband and I said, "Give me a couple of baby aspirin." And he immediately called the paramedics. The paramedics took me, lights on, and I was asking them why. And as it turned out, I had a heart attack. And when I got to the hospital, I flatlined. So the amazing team of cardiologists and trauma workers and everyone at Summa Health, they brought me back. And I had to have a stent put in, and I got a second chance at life. And with that came the knowledge that I was going to have to make some life changes. So I did 36 weeks of cardiac rehab. I went to see my cardiologist in December, and he said, "Now I want you to start, you need to walk at least 5,000 steps a day. And when you hit 5,000 steps, then I want you to get up to 10,000." Because my life had become very sedentary, and so that's what we did. So lo and behold, January, the step challenge came up. So 4 of my coworkers and I formed a team. I have, along with Jen, some of the greatest coworkers you could ever ask for. Dawn was our taskmaster. She would come in every day and say, "How are you doing? How many steps did you take yesterday? Did you record your steps? Here's where we are versus the other team." And we had a lot of fun. We would, on our lunch hour, go down to the gym and walk on the treadmills, a lot of different things. We didn't win a lot of our challenges that first year in 2019, but it came up again in 2020. My daughter got me a dog for Mother's Day in 2019, so I got my walking started and my habits of walking through the step challenge at Summa Health. And then I walked with my dog every day, and we still do. And then 2020 came, and the 5 of us formed a team again, same 5. We actually won some of our challenges this year, which was exciting to us. But, you know, a question came up earlier about, was it unmotivating in any way? And it's not. It was just a great way to form bonds with my coworkers, and get back into the lifestyle and everything that I needed to do. So I am extremely thankful for Jen for putting this together, for WebMD. It made a huge difference in my life, and I am so appreciative of everyone. Are you still there, Jen?
Mary Jo, we can hear you okay. Jen, are you still there? You might have your mic on mute. It's a great picture of Mary Jo of you and your dog.
Thank you. She's a rescue, and she's my little shadow. She is with me constantly. So
Can you hear me
as
now?
is my team.
It's an amazing story. It's an amazing story.
Can you hear me
Jen,
now?
are you back on?
I'm
I can't hear you, Jen, if you're on.
I hear you, Jen.
You hear me now?
Okay.
I hear you.
Okay. Sorry about that. So I'm going to turn my camera back off, and I hope that works. Can you still hear me?
Yes.
Okay. So I do have a question for you. Did you develop any new habits or make other changes during the course of the challenge?
I did. If you knew me previously, you would always see me with a Coke in my hand. Now you see me with a water bottle in my hand. I was not drinking near enough water. So I've started drinking more water than I ever thought I would drink in my life. I have a very Southern upbringing, and fried foods, if you cook in the South, you fry it. And I had to get away from that. My nephew bought me an air fryer for Christmas that year. I use it all the time. So a lot of changes I had to make, but they were definitely well worth making. And they all started during the step challenge.
That is wonderful. I love the picture of your dog too, and I heard him in the background. So he's a good motivator for you.
I'm so sorry. She's been quiet the whole time. And as soon as I started talking, she decided to bark.
I love it. So what else would you like people to know about your story?
I want those who don't do something like this at work for their employees to know how motivational it really is for your employees. I mean, it's far more than just motivating them to do the things that they need to do, like the walks and the steps. I had relationships with my teammates before, but we just grew a stronger bond, and competing against we knew people and other teams. And so it just really strengthens your organization and your coworkers and your department.
Thank you for sharing. And what would you like people to know about heart disease?
You need to pay attention to your body. I did not have chest pain. I didn't have the elephant sitting on my chest, as some people describe. In hindsight, I had gotten a little more tired and didn't have quite as much energy. But if you feel something isn't right, get it checked. Call your doctor. Had my husband not been home, I would not be here today to share this story. I would not have called 911 myself. I didn't feel that bad. I just felt that something was not quite right. And I had 100% blockage in an artery in my heart. So as you start slowing down, as you aren't feeling well, go get checked. It is so very important.
Wow, thank you, Mary Jo. And I'm so thankful that you have shared your story and encouraging individuals to listen to your body. Heart disease is a silent killer. You need to pay attention and take action. And I'm so happy that you participated in the Invitational and it helped you increase your steps and have that camaraderie with your coworkers. Thank you so much for sharing your story with us. And I'm so grateful that you joined our webinar today.
Thank you, Jen. And thank you for all you do. I really, truly appreciate you. All of us do.
Thank you, Mary Jo. All right, so wipe your tears and shake off those goosebumps and go get your preventive screenings. Make sure you get your well visits. Let's talk a little bit of utilization. If at all possible, I'm going to switch gears and talk about it. So here are some numbers, and I want to explain them real quick. So in 2017, this is when we had one large hospital system using the rewards platform. In 2018, the same client used the rewards platform and also started implementing challenges. So as you can see, even though the unique users went down a little bit in 17 versus 18, the site visits went up and the pages viewed went up. Now, when you look at 19, this is when Summa Health came on board and implemented the challenge, the Invitational challenge, and the sleep challenge. So they did 2 challenges in 2019, and they still did not have a rewards program. So that is just one client implementing 2 challenges in that year. And the numbers speak for themselves. So when you look back to baseline in 17, we've really only increased unique users by a couple hundred, but total sites visits significantly increased and the total pages viewed just skyrocketed. So that's what implementing challenges alone can do for your utilization. And I would be dismissed if I didn't mention how COVID changed our communication to our members as well as our employer groups. So I have to mention how it affected our communication strategy. So pre-COVID, Summa, launched their rewards program. This is this year, 2020. They launched their rewards and the invitational right before COVID wreaked havoc on everything that we did. Mercy, they also launched their rewards program and a 5 to Thrive challenge. So their 5 to Thrive challenge was scheduled for April-ish, and they wanted to continue with their challenge because a lot of staff went remote, and using the challenges is all digital, and they were able to still participate in the employee wellness program, but remote. So the benefits are customized to include health plan benefits and employer-specific benefits. So this picture right here is the home page that is also very customizable for each employer group or line of business. So we have a Medicare homepage that is dedicated just to Medicare, about our Silver Sneakers program, any events that we have going on for Medicare members, and any specific health tips you want to give to that line of business. So as well as your employer groups like Summa and Mercy can promote their diabetes education program out of the hospital, the medical nutrition therapy with their own weight management programs, and any health benefits they have or virtual events. So the homepage is a wonderful source of communication for different groups. So this is what we were using already before COVID. Now, during COVID, SummaCare started promoting WebMD's health services, their stress management tips through social media. So we launched social media during COVID. We did not have Facebook, weren't really that active with LinkedIn prior, and we are even launching Instagram. So for the timing of WebMD to produce these stress management tips, they have videos and articles, and we started just tapping into those resources and started pushing those out through our social media platforms. We also repurpose their on-demand mini webinars, so we share them to our employer groups via email as well as LinkedIn. And Mercy Medical Center continued their scheduled invitational challenge. Like I stated earlier, they did not want to interrupt their existing plan. They kept right along. So do we use social media to promote, or do you only use social media to promote wellness program updates? No. So we use social media to promote everything. We have our benefits. So a lot of our population is dedicated to our Medicare product line, and our communication is as well because of our CMS star ratings and getting the preventive screenings. So we do a lot of communication to our Medicare members. It's a lot of frequently asked questions on educating them on how to use their insurance plan, how to understand co-pays, co-insurance, deductibles, a lot of health literacy type questions, also promoting events virtual events, health tips, recipes. We do Facebook Live events. And do we find if we are still able to reach older audiences through a digital presence? Yes, the older population is active on social media and the internet. Yes, you will have that smaller pocket of Medicare members that aren't engaged or don't have a computer or a smartphone. You will always find that. But the senior populations technologically, they're getting tech savvy, and it is constantly growing, especially during this pandemic. They're starting to get more connected to family members, and they're utilizing the social media platforms as well as, the Skype and Zoom and those type of platforms as well to be able to connect to family. I know personally my grandma plays more games on Facebook than I do. So they are utilizing a digital platform. So post-COVID, as I had mentioned, we were new to the social media platform, so we are going to continue to leverage that. We, like I said, have launched Facebook Live. Next month for September is Fall Prevention Month, so we have a physical therapist joining us to talk to seniors about fall prevention. Facebook Live, we will record that session and post it on our website, and we can also send communication out to drive them back to our website. We are continuing to learn to leverage resources that we already have. So like I mentioned earlier, WebMD had videos and stress management tips, but they've also launched podcasts and more videos around recipes and baking healthy items. So we are leveraging our resources more. The changes we have made is we started a blog. We started being more strategic with our Facebook Live post, and we are creating that Instagram account. And we're also highlighting employees to make it feel more personable because we are that smaller Northeast Ohio regional plan. That is our niche. We are local. You can walk right into our office and talk to a customer service staff. You can see our faces. So we really want to bring that family feel, that local vibe to our presence. We are launching email campaigns. We just did that last month. That was our first communication. So we will be doing more email communications, and we are going to do a live tutorial video to promote WebMD Health Manager. So I just realized I'm over, so I apologize. If you have any questions for SummaCare as a fellow colleague, how we utilize WebMD, how we utilize social media, how we target Medicare members, feel free to reach out to me. My email is yatesgay@summacare.com, and I'm also a Health Plan Alliance member, so feel free to reach out and get connected with me. I will pass it back to Christiane. Thank you very much.
All right, thanks, Jen. Are you guys able to hear me?
Yes.
Okay, wonderful.
Yes, we
I'm
can
going to
hear you.
leave the camera off so we don't have any issues. We'll keep it real brief. We just wanted to end and let you guys know some exciting news about WebMD and where we're at. WebMD acquired Staywell back in the spring, and we have been working together to combine the expertise and the strengths of both organizations into one bigger and better platform. We are very excited about the additional capabilities and the additional expertise that the Staywell team has brought to our organization. So just wanted to share that news with everyone on the call. I also wanted to just say thank you so much to Jen and to Mary Jo for being here today. Jen, thanks for sharing about what you guys have been doing with challenges at SummaCare and the successes that you've seen. And Mary Jo, thank you so much for sharing, your story. It's so inspiring, and it's why we do what we do. So thank you so much for taking the time to do that today.
All right. Well, thank you very much, Christiane and Jen and Mary Jo, for a wonderful presentation today about WebMD and its implementation and how you guys are working with SummaCare, one of our members. Thanks for putting that up. Here's Christiane and Jennifer's contact information to all of our members. If you feel free to reach out to either of them. Their contact information is also in the event site where you registered under the speakers tab. If you do have questions for them, feel free to email them directly, or you can contact me here at the Health Plan Alliance and we can help you get in touch with them as well. As I mentioned earlier, the entire presentation was recorded today, so if any of your colleagues were unable to attend today's webinar, the recording will be available under the Documents tab, the same place where you'll find the presentation on the events site. If you're unable to find that, just shoot an email to Ro and I, and we'll help you get connected with that. But again, the recording, the presentation today will be on the events site under the Documents tab. If you do have questions, again, reach out to us here. Also reach out to the team at WebMD or to our colleague, Jennifer Yates, over at SummaCare. When you log off, there's going to be a brief survey. We'd appreciate you taking a few minutes. It doesn't take more than 5 minutes to answer the questions of the survey, feedback on today's experience with this particular presentation, and also with our overall Vendor Spotlight webinar program. To Christiane, to you and your team at WebMD, thank you so much for sponsoring today's webinar and for giving us more insights to the great services you offer to your clients and customers. And Jennifer, thank you for being one of our member plans, participating in this case study and sharing with us the best practices you guys have implemented in working with WebMD. And to Mary Jo, thank you for a great success story. It's always great to have that personal touch to understand how these programs like this actually work. And you know, you're a success. You're someone that we can all emulate. And thank you for sharing that great success and how you made changes in your life because of like you said, you got a second chance. So we're great. We're so glad that you're here with us and that you're able to share that and be a role model for many of us so that we can continue on in our lives in a very healthy and successful way as you are right now. So to all of our members, thank you for joining us today. To the team at WebMD, thank you. And to our colleagues at SummaCare, thank you for today's presentation. Have a wonderful day and be healthy, everyone. Thank you.